Ruthless Compassion is a podcast about how you can turn your emotional shit into fertilizer for success and see your darkest moments as opportunities to transform into a powerful kindness warrior. If you enjoy this podcast, please leave a review wherever you listen. Hello, welcome to the Ruthless Compassion podcast. I'm Dr. Marcia Sirota, and with me today is Vicky Stergiopoulos, a psychiatrist and expert in homelessness and mental health in the community. And we're going to have a wonderful conversation, I'm sure, today. Welcome, Vicky.
Thank you for having me.
Well, I'm so excited to have you, as I was telling you before we started, because the things that you're working on are more relevant than ever these days. And before we get into it, I thought maybe you could share a little bit about your background, who you are, what you do, so that the audience is familiarized with you.
Well, I'm a psychiatrist and a scientist. I work at the Center for Addiction and Mental Health. And I'm also a mom. I have 2 adult children. My clinical work is focusing on people in crisis. And my research work is focused on housing, homelessness, and health, specifically mental health. I've done studies that have looked at housing models, how best to support housing stability and better health for individuals that experience both homelessness and mental illness. I've done studies that looked at how best to coordinate care between hospital and community. And my current research projects focus on 2 areas. One is how best to integrate physical and mental health care within specialized mental health settings in community mental health. And then also how to understand the needs of those individuals that need 24-hour support to maintain housing stability. So high support housing, and how do we understand that? So these are the projects I'm working on right now.
So right now, it's a very difficult time because financially, we're obviously in a big crisis post or sort of post-COVID. We're still in COVID, but post the most acute stage of COVID. And the federal budget just came down, and there's no support for Toronto, of course. And the feds are saying, look to Queen's Park, and Queen's Park is saying you look to the feds, and everyone's passing the buck. And Toronto barely has enough money to repair its basic infrastructure. So where are we finding the funds to do all of this for people?
Well, that's a good question for the voters and the types of governments that they'll elect to power. Governments that will be able to look beyond the 4-year election cycle to make the basic investments in infrastructure and supports that are needed to address the crisis that we're facing now. And I trust that you're talking about the crisis in the rising number of people that are homeless, also the violence that we are seeing specifically in Toronto and in other cities in North America around the TTC and other public places. And again, it's not a single level of government. It's not a city of Toronto. It's not the provincial government. It's a whole government approach. It needs to involve all levels of government and beyond government, healthcare, social services, and individuals that are affected by mental health problems and illnesses, and individuals who live in poverty, coming together to figure out how best we can get out of where we find ourselves in right now.
Well, why don't you, because you're the expert in this, why don't you share how you see the crisis? Like what's going on right now that people are being stabbed on the TTC and pushed down in the street, by strangers wearing strange masks who have homelessness and mental health issues. What's going on in our city and in North America, as you say, right now?
And I think if we look at the rising numbers in people that are homeless and the increases in violence, the underlying causes are similar. I think you probably know as well as I do that the risk factors for violence include victimization and a history of abuse. And that, augmented by lack of adequate housing, lack of income support and employment, mental health and addiction issues without supports for them, it's not surprising that we're seeing what we're seeing. And I'd like to stress that it's not that TTC or our public places are inherently unsafe. It's just that at the moment, societal problems have migrated to these spaces. And so I'm puzzled by some of the solutions put forward. And it's good to put patrols and constables and outreach teams in those spaces. It will create a sense of security, if you like, a sense of safety that may be quite false sense of safety, because the problem will migrate in another space. The problem, it doesn't solve the problem, which would involve, if we look at societies or cities or countries that have made progress in reducing violent victimization, violent crime, you look at investments in early childhood education and early childhood programs, investments in programs for youth at risk, employment training, affordable housing. If you don't see high rates of violent crime among people that are connected to their communities, that have jobs and a roof over their head. So I think this is what we need to be looking for. This is what we need to be voting for in the years to come.
So, to paraphrase you, you're saying that this problem with violence in our public spaces is really a social problem, and policing after the fact is not the solution. We need to address the social problem, which is to have supports from early childhood and for teens, and employment for adults, mental health resources available for people of all ages, and affordable housing. And these are the social factors that are necessary, not adding more police. Because, like you said, if we put police in one place, then these disturbed individuals will just find another place to act out their traumas.
And I think beyond that, if you even look at the math, they're looking at perhaps putting 50 constables right now. I think that's the number, the latest number that I looked at. But we have how many subway stations? 75. And how many bus routes? 192. And how many bus stops? And between buses and streetcars, 8,000 in Toronto. Like, it's just, the math doesn't add up. And I think what troubles me, it's not only that's sort of an easy fix, or it's not even a fix, but let's pretend that we're solving the problem. The other worrisome thing is looking south of the border, what's happening in New York, and now increasingly in other states, even democratic states like California, where they're looking at lowering the threshold for involuntary admission and bringing people that are homeless, picking them up and bringing them to hospital, as if, again, that's going to solve the problem, thinking that healthcare is going to fix a social problem. So there is a lack of understanding of either lack of understanding or lack of will to actually act on that understanding.
It's very unfortunate, because even our governments and social service agencies are still looking for the quick and easy solution, as opposed to a more systemic and meaningful solution to problems which are only going to get worse over time.
Absolutely, it's short-sighted, and it's not. I think all these things might make the public feel a little safer and maybe justifiable. So, but again, I believe that the problem will migrate to another sector or another space, and it's not going to go away.
Well, it's already done so. I was just writing a blog about how people are turning to vehicles as a way of acting out their violent
Mhm.
urges. And, just in Quebec in the last month or two, we've had two incidents of people running into, one was a daycare and one was a crowd of people going for walks, and killing a number of individuals. And that was so tragic, especially in the daycare. And, these were obviously people who were quite disturbed. One of the men, the one in the daycare, jumped out of his bus and was tearing off his clothing and behaving erratically, according to witnesses after the event. So clearly he was in the throes of some mental disturbance. And again, what are the solutions? That everyone is saying, we're praying for the community, but who is proposing solutions to these kinds of things? Because you're right, if it's not in the TTC, it can be people taking to their vehicles. If it's not in the public streets, it can be, like in the States where people are shooting up movie theaters and churches. There are so many different options for people if they want to act out violence.
And I think, again, when we look at crisis support, the other things that I read about is, providing crisis supports. But I think, again, we're not looking at crisis supports comprehensively enough, which it includes not only acting at the time of crisis, but providing supports before somebody reaches the point of crisis, and then supports after a crisis to make sure that individuals don't get into a crisis again. So again, we're trying to find kind of easy fixes that are not going to actually fix anything.
So what made you interested in working in these areas of community mental health and homelessness? Like where did you find that passion to work and study in these areas?
I think when I graduated, even during my residency at the University of Toronto, I came across in our emergency departments across the city a number of homeless people. And on staff, I started my career at St. Michael's Hospital in the inner city of Toronto. About a quarter of my patients were homeless. And I would see them, admitted and discharged and cycling in and out. And I would see them on the street and on the pavement. And I started doing work in the shelters because, how do you follow somebody who, requires ongoing psychiatric care? If they won't come to you, you go to them. So I started doing work in the shelters, and then worked on developing programs for people that are homeless and have mental health problems in shelters, and doing outreach, and started doing research to figure out what solutions we could scale up to effectively end homelessness in this population. So it was just following the people that nobody else wanted to follow, essentially, and trying to find not just short-term solutions, but long-term solutions. And some of our research has had good uptake. Like we did research on housing first, which is one housing model for people that experience homelessness and mental illness. And the federal government has invested money on it, like it's spread around the world, and it's considered the best practice in housing for people with mental illness. So there are a lot of good moments in this, but there is also frustration when we see that there are not adequate investments, even in models that there is evidence that not only work, they will eventually save money. Because they pay for themselves at the end. So there are frustrations that despite the work, despite the advice, despite the evidence we produce, the investments in the solutions that would work are not there. But what drives me is hope and curiosity, and I guess inspiration from the people themselves that experience such challenges, and keep on going. Because again, I think when we think about homeless people, it's important to kind of remember that many of them have histories of profound trauma and victimization. And they need a lot of support, and solutions that will work.
I remember years ago, I came across the adverse childhood events study, and how it was saying that if you have more than one adverse childhood event, and that could be any type of adverse event, your risks of being incarcerated went way up, your risks of having an early death went way up, your risks of substance misuse went way up, and that's just two adverse events in life. And your population that you're working with have multiple adverse events in life.
Absolutely. They have, I can't remember the number. We did that study a few years ago when we actually looked at the number of adverse events. I believe it was an average of 4.5. So like just very disturbing number. And the people that we see on the day-to-day beyond research, the stories are kind of heartbreaking. Like you kind of wonder of how are we capable of acting like that towards each other. But again, yeah, you ask what kept me going and why I was interested, and I think this is why I thought there's something to be done, and there could be help coming to this population, and I'm very proud to say that a lot of our physicians in Toronto, a lot of our trainees in Toronto, not just in psychiatry, but also family medicine, internal medicine, public health, are now working with people that are homeless. When we started this work 25 years ago, there was a handful of us. I think we were measured in the fingers of one hand, and now there is hundreds of physicians that are working with this population, which is a good start, but that's not the solution, because it's not just medical care they need a lot of social care and resources.
So there's a mayoral election coming up this summer in Toronto. What would you be looking for in the platform of the mayoral candidate that you would want to elect apropos of these important social issues? What would you want to hear them saying?
First of all, I wanted to see that somebody understands the issue, has a deep understanding of the issues. And I would also like to see somebody who understands that the solutions involve multiple sectors and level of government, and can demonstrate the leadership to bring a table together that can work across sectors and level of government to move things forward. This is what I would like to see. So it requires, compassion, but it also requires determination, perseverance, and leadership.
So, but what would you want to hear them say about this problem? Like, if they were having a speech and you asked them a question, how are you going to deal with this problem of violence in our public spaces? What would you want to hear somebody like that say?
I would love to hear them say that, first of all, they'll have to learn about it and understand it better. That they want to understand the root causes, they want to consult with experts, they want to bring a table together that brings health, social care, police, if you like, the TTC, the provincial government in one table, and try and, along with people with lived experience, both homelessness and mental illness, to figure out what are the best ways forward.
So, someone who is open to learning
Yes,
and motivated to create real change,
absolutely.
not someone who's just saying we're going to put more police in the TTC.
No.
That's a good answer. Thank you. Yeah, because I think about that. We have an opportunity very soon in the next few months
Yeah,
to vote for somebody who could enact some proper change. And so we need to know what to look for. We need to know how they are going to answer the question about how to deal with this. And if they just say, oh, we'll throw more money into Band-Aid solutions, clearly that's not the candidate for us, for things to improve in our city.
absolutely not. We need to go way beyond that. These solutions don't work. And I think if you want proof of that, we, over the last 10 years, we're hearing 10-year plans to end homelessness. And not only we haven't ended homelessness, we haven't even been able to manage it. The number of homeless people increases year after year. Because again, we're not taking a full societal lens, a full approach. We're looking at individual kind of determinants and think that they will make a difference when we're not addressing the basic issues of inadequate income supports and lack of affordable housing and health supports.
So really people need a living wage,
Yeah.
they need affordable housing, and they need health care and mental health care.
And social support.
And social support. Not that complicated, really, when you think of it.
Absolutely not. It's doable. And this is what's the most frustrating thing for those of us that work in this field. It can be done. It's not, it shouldn't be that hard.
Do you know of places, I heard that Scandinavia does well, but do you know of places where they have really addressed this successfully using those fast factors?
I think definitely the Scandinavian countries are doing a lot better than us. And even beyond homelessness, if you look at those that have a serious mental illness, they do much better in those countries than they do in North America. In terms of housing and in terms of employment and relationships and social supports. But even if you look at some of our own provinces and some of the initiatives that have been done, say in Alberta, in some of the northern cities in Alberta, where they managed to eradicate homelessness or significantly reduce it by investing in housing first. So we can look not too far from home and see the leadership and determination and use of evidence-based approaches to solve a problem. So yeah, we can look. You can look both near and far for inspiration.
So I'm going to ask you a question which might seem a little disingenuous, but I'm going to ask it anyway. Why do you think our politicians are so reluctant to engage in this kind of discourse and to pursue meaningful solutions? What makes them seem so reluctant?
Because the solutions are not working for the four-year election cycle. These are solutions that will take, a decade or more to manifest results. And so it's not it's something that they can, use to maintain their position or to be reelected necessarily. And unfortunately, politics is driven by self-interest in some way, like self-preservation, if you like. There may be interest in the communal good, but ultimately there is a great interest in self-preservation, and so these programs unfortunately don't lend themselves to that.
So we need a sophisticated politician who is able to articulate to the population that this is a longer range plan, but that it will cause them, cause the population to do a lot better, in the future. And if they can be patient, that, they will see the fruits of the politician's labor, but they have to have patience. And I think most of us are too focused on instant gratification these days.
Yes. It would require somebody who is able to articulate a vision and express it very clearly. And unfortunately, we haven't seen that yet.
And the population, the voters need to recognize that solutions to systemic problems are not quick fixes, and we have to have faith in our leaders if they make sense, if they have a vision that makes sense and that we can follow through to the logical conclusion. And we have to have patience and trust that it will happen in time, and we can't expect it to happen in the 4-year political cycle.
Absolutely. And I think this is where the media have such an important instrumental role to play, providing education to the public, elevating the dialogue at that level of what are we needing in the long run, and how will we get there beyond the immediate kind of short-term things that a 4-year government can accomplish.
So if you were a journalist and you were speaking to, if you were speaking to the general public, what would you want them to know about this problem and the solutions that are available?
I would like them to know that there are solutions, that their solutions are within our reach, and that the solutions will take leadership, determinations, and patience, because to see the fruits of the solutions might take some time.
So we really need to have a visionary leader, but we also need ourselves as a citizenry to not be expecting a quick solution, a quick and easy solution.
Yes, I think we can expect to see determination and commitment to act, but knowing that the results will not be immediate. Absolutely. But the actions will be, the action can come. It's just that the result will not be evident for a while.
I think of a funny example of like losing weight, right? Because you're on your regime, you're doing your exercise, you're doing everything right, and maybe you have 50 pounds to lose, and it feels like it's just taking such a long time, but you're losing a pound and then another pound and then another pound, and suddenly, when you've gotten to about 30 pounds, you suddenly notice, wow, things have really changed. But it's such an incremental, gradual change that you don't quite notice it until there's like a tipping point, right? So I can imagine it being similar in this situation where little changes are happening bit by bit. And then when it gets to a certain tipping point, that's when we really notice a difference.
But ultimately, we're talking about a difference that ultimately will be profound. We're talking about a society that's fair and just, a society where everybody can thrive. A society where no one is left behind, a society that's compassionate, where people reach out to each other. When you look at, in the UK, they created the Ministry for Loneliness. And why did they do that? Because, as you know, loneliness is as bigger risk factor of mortality, of death, bigger factor than smoking. So yeah, there is lots to do, and I think if you ask me what our audience can do for each other, be there for each other, reach out to each other. If you see somebody in your circle struggling with mental health issues, reach out to them, support them, listen to them. And again, the only fear that I have is with all this discourse about homelessness and mental health and addictions and violence. So this population already experiences a lot of stigma and discrimination. And I wanted to plead with the audience to not let these incidents of violence feed to that, because this is not a problem of the individuals, this is a problem of our system, and the constraints that this system puts on individuals that act in violent ways. So we're asked for compassion, understanding, and support, and choosing our leaders, our politicians wisely.
I remember learning that the population of prisons is made up disproportionately with people who have developmental delays and mental illness. Could you comment on that?
I cannot speak to the prison population per se because I don't know these statistics, but I can tell you that when we did a study across Canada to look at housing first for homeless people with mental illness, I was impressed by how many people had learning disabilities and school failure. And so we did a study in Toronto. We looked at the prevalence of intellectual disabilities in the homeless population. And lo and behold, 17%, 17%, a huge number compared to the general population of homeless people in Toronto had, the ones we recruited in the study, had an intellectual and developmental disability. So you can see when talking about at-risk youth, when you're talking about early interventions, some of these individuals were missed altogether in the system growing up. And others were not missed. They were connected to supports, but at the transition from the youth system to the adult system, they fell through the cracks. So these are the kinds of things that we can do easily better.
It's true. I've heard a lot of people who, once they stopped being a teenager, they lost all their care.
Mm-hmm. Any transitions in care, even from the child to the adult system or from hospital to the community, is a point of risk for disconnection from supports. These are times where individuals need increased supports.
So if there's one other thing you would like the general public to know about this population of homeless people, people with mental health issues, what would it be?
How much we can learn from them about survival, about resilience, how sometimes I'm inspired by their acts of generosity. You see somebody, for example, although not healthy, sharing what little they have with the person next to them. So it's really inspiring, and to me, this is what makes this work worthwhile. To see the generosity and to remember that every one of them is somebody's son or daughter or sister. They all have families.
Yes. So what is your current research project? What are you working on right now?
Well, I'm working on a couple of things. One of the papers I'm working right now has to do with the medical assistance in dying for people with mental illness that we anticipate to come into effect next year. And then one of the studies that we just got funding for is looking how best to integrate physical health care in specialty services, because as you know, people with serious mental illness die 20 years sooner than the general population, and they don't die of mental illness, they die of undiagnosed and undertreated physical health conditions. So given this mortality rate, what can we do within mental health settings, given the majority of those that have serious mental illness don't actually access primary care. They don't do well in those settings. They don't reach out. So what can we do to decrease the mortality gap in mental illness? So that's one area of interest, and we hope to not only look at how best to integrate physical health monitoring in specialty services, but also in community services like in supportive housing where people with serious mental illness live. And the other passion of mine right now is to look and examine high support housing and what does it look like and what it ought to look like to promote recovery for those individuals that require this type of support. Research projects and research ideas like come day in, day out. So these are the current projects, but my team and I will be working on more in the coming weeks.
And if people want to learn more about the work that you're doing, where could they find you?
They can find me at CAMH. They can email me. It's my first name dot my last name at camh.ca. Yeah, I'm not on social media, unfortunately. I'm not. I don't have access to that, but you can always email me.
Well, now you are. Now that you're on this podcast with me. And just before we end, I know you've given quite a lot of calls to action, but a final call to action for the listener, especially, our citizens who are concerned with what's been going on in Toronto and really across North America these days. What call to action could you give them?
I think, first of all, I think a reminder that we all have the right to feel safe in the public places. We shouldn't be dreading to take the TTC or to be in a mall or anything like that. We have the right to feel safe. And I think the advice, again, is to reach out to each other, support colleagues or friends that you see struggle with mental illness. I can easily say donate to mental health causes, but that's beyond the point. I think it's important, and it's equally important to use your votes wisely.
Well, thank you so much, Vicky Stergiopoulos. I really appreciated talking with you, and I love your point about how important it is that we have compassion for one another and to live in a society that's compassionate, and to not forget that, because I think sometimes we lose sight of such a simple concept. And since this is the Ruthless Compassion podcast, I love that you're bringing up the word compassion and really reminding everyone how important that is. That's such a simple thing, but we can forget.
Absolutely. Well, thank you so very much for having me. Have a good evening.
This is Dr. Marcia Sirota. Thank you for listening. Please leave a review and your comments wherever you listen to podcasts. And don't forget to sign up for my free newsletter at marciasirotamd.com, where you'll learn about upcoming online events as well. Also, we love getting referrals from our listeners about future podcast guests, so please email us at info@marciasirotamd.com.